Hi, I'm Dr. Amber and I run a skincare clinic just outside of Norwich. My specialty is helping patients to understand which products to use safely for their skin type and their skin colour. Today's topic is pigmentation, and particularly with a focus on skin of colour. Patients with skin of colour have larger, what are called melanosomes, which help to store and transport the melanin in the cell. So they are bigger and they are distributed throughout the skin more evenly, as opposed to someone with pasty skin like myself, where the melanosomes are smaller and they tend to be more in little clusters, which might create like a few little freckles rather than the even distribution of colour you'll see in patients with skin of colour. So patients with skin of colour are more prone to hyperpigmentation, especially after things like just a simple breakout can leave them with really frustrating dark marks, and also they are more prone to pigmentation on the eyelid skin. And so it can be really confusing understanding which products are safe, and then also thinking, can I use that on my eyelids? Is it even safe for my skin type and skin colour? Will it be too aggressive? So I'm going to talk through some products and just a little bit of science about how you can incorporate safe products. It's not about being aggressive and stripping your skin barrier. It's about using products that suppress the production of pigmentation and also understanding how to prevent the extra pigmentation in the first place. So let's just talk about something which is absolutely non-negotiable, and that is sunscreen. Yes, skin of colour has that more even distribution of pigmentation, so they are less likely to burn, but ultraviolet rays are still radiating regardless. So you can still get skin damage, skin cancer, sunburn and pigmentation, even if you have skin of colour. So the most important thing is that you're going to wear your SPF every single day liberally, and you're going to top it up. And there are lots of different options now. Previously, we had really limited options for skin of colour that dried chalky, that dried white, left what's called a cast, which is not nice. Now we have the CC creams, which come in medium and dark. We have the compact shades, and lots of my patients with skin of colour find these products really blend in very nicely into their darker skin types. So you must reapply your sunscreen regularly and liberally. And for patients who suffer with pigmentation, there is evidence that using pigmented sunscreens is better for you. That helps to prevent the pigmentation, particularly if the pigment is iron oxide, which is what is used in these products. Next, you want your pigment suppression, and that's going to be a range of different ingredients that, again, are safe for you to use every day. So one of my favourite products for skin of colour is the Melaserum. This has an ingredient called butyl riscorsenol, but it is also a hydrating and antioxidant serum. So it's really gentle, but there are some really good clinical trials on butyl riscorsenol showing how they can diminish pigmentation. So this is safe to use over the whole face and also on the eyelids. And my darker Fitzpatrick patients have used this on and around the eyelid skin, and it's great. Definitely lightens up that darkness from pigmentation and doesn't cause irritation. Next, we have the MD range. This is the specialist range that contains all of your antioxidants and your special ingredients. So for example, this tube here contains retinol, glutathione, mandelic acid. It contains lots of things, arbutin, that we know suppresses pigmentation. So it's already in the pump altogether for you. So you don't need to think, oh, what acids should I use on my skin? I don't really know. The MD specialist range is all ready for you. And again, that is safe for all Fitzpatrick skin types. That can be used 1 to 2 times a day. And that again would go all over the face, but not directly over the eyelids like the Melaserum would, because of course this contains acids. On top of that, you would put something like your niacinamide day moisturizer and then your sunscreen on top of that. Next, we're just going to touch on tranexamic acid, because this is a really good ingredient that has been shown again in clinical trials, both orally and topically. This is a topical serum to help again with pigmentation, and especially in skin of colour, being a very safe ingredient that helps to suppress that pigmentation pathway. And again, in clinical trials, after several weeks topical use, the patients have lightened areas of pigmentation that were bothering them. So this is used at night time. And again, it's massaged onto the whole face, avoiding the eyes, and then you can follow up with a moisturiser as well. I haven't included prescription products today, such as tretinoin, because I'm going to cover that in another video. But these are just a few examples of some of the products that are out there that are very safe for skin of colour and have evidence science-backed ingredients. If you're unsure what products to use and you need help, I'd love to guide you. Just pop me a private message and I can help you further. Thanks for watching.